We'll go ahead and get started. Dr. Zeest, thank you so much for making time for us.
Oh, it's my pleasure.
So, Trump signed this executive order last week, I believe it was, and so there's a few things that, So first of all, I guess I maybe a lot of folks already know, but let's just talk about like what's in this order. What does it actually say?
Yeah, so the order refers to a organization or a task force called the Gold Standard Vaccination Team, something similar to that, and Gold Standard Childhood Vaccine Recommendations, based on a task force for responsible vaccination. And those two things are new since RFK Jr. has become HHS secretary. This is not something that they are continuing that is a scientific methodology or a group that has existed in the government before. Their purpose, it seems, is to find evidence that vaccinations are linked primarily to autism, and therefore, in the name of parental freedom of choice, they want to reduce or minimize the number of recommended vaccinations. So, one thing to know about this executive order is that it is laying out recommendations. There is not a lot of there's not a lot of teeth in this. These are recommendations by RFK Jr.'s task force or based on them. They do not influence the way that drug manufacturers produce vaccines, which is something that we need to talk about because it's actually pertinent here. And it doesn't at least immediately impact clinical care. What it does is cause a lot of confusion. So, what this executive order lays out is the recommendations of this task force of what vaccinations they recommend, which vaccinations they recommend less. And which vaccines they don't recommend. Of note, President Trump said that the MMR vaccine, which is a combo vaccine that includes measles, mumps, and rubella, and more recently, some add varicella, the virus that causes chickenpox, in one single injection protects kids from 3 to 4 viruses. He said the combo vaccine is fatal, which
Yeah,
is
he said.
not based in fact.
Yeah, he said something like it could be lethal. Yeah.
It's lethal. Yeah, that's the word he used. And when they're separated, he said they're not lethal, they're safe. There is no medical need for separating the vaccine. There is no scientific need. There is no safety need. There is no science that supports this move at all. What it does is causes confusion for parents. And what's very important to know is that the MMR vaccine is not available separately the way they are recommending it should be.
Right. It's been years since anybody's made those vaccines independently.
That's right. And there is no incentive on pharmaceutical companies to invest capital into manufacturing these separately when this is a president who theoretically is going to be gone in 2 years. And there's no medical organizations that recommend this either.
Well, speaking of organizations, I mean, a couple things. One is, and I know you've already kind of pointed this out, but I think we can stress it more, is that like sort of executive orders are not the place, sort of the medical practitioners look for guidance historically in general. And, so the recommendations to drop some of these vaccines are in conflict with the American Academy of Pediatricians, AAP. Can you tell us just a little bit about the American Academy of Pediatricians and what this order means for them?
So the American Academy of Pediatrics is probably
pediatrics.
or of pediatricians. I'm not sure which word that P stands for, but
I think you're correct. Pediatrics.
Yeah. So they are a organization that represents their physician specialty. And they're more than probably any other specialty group. Maybe ACOG is a close second. Um, advocate for their patients primarily. This is a advocacy group that's really centered on patient care. They are right now they brought Kennedy a lawsuit recently against his choices of members of the Advisory Committee of Immunization Practices, ACIP. ACIP is a group that is typically composed of about 15 to 17 scientists who are experts in vaccines, and clinicians, physicians who are public health experts also. There's always like a patient advocate representative on the panel too. But when RFK Jr. took over as HHS secretary, he eliminated most people on that panel and replaced them with anti vaccine skeptics, many of whom have no experience in vaccinations. So, the American Academy of Pediatrics has been pushing very strongly to make sure that the current vaccination schedule, whatever is in the best interests of their patients, is upheld.
And it's an independent organization, right? It's not government.
It's not a government organization. That's right.
So, a few things that I've seen noted about some of the potential consequences of, because I've heard people say things like, "Well, it's not a mandate; it's only a recommendation, and so, don't worry. It's mostly signaling, to sort of pacify RFK and the MAGA movement." But I mean, there are potential real consequences here. One you mentioned is just the confusion that it does. But there's a couple I want to talk about. One is the sort of something else you mentioned about parents, right? So this could leave families, starting to believe the MMR, the combined vaccine, like that is well known to be safe. They could start believing it's unsafe, and that could be a challenge for pediatricians, right?
Absolutely. Upwards of 40% of people, according to a recent poll, trust what the president says on medical information. And that's really dangerous because he keeps spewing lies about medical science. We can think back to the Tylenol situation. And this is really pushed by RFK Jr., who is a fanatic, like a zealot with this. So this is really a philosophy that's deeply embedded in him, it appears, and he is really trying to push this agenda. So a couple of things are concerning about this vaccination executive order in real experience. One, it gives the clear impression that MMR is available separately. And again, it is not. And so when parents show up to their pediatrician appointments with their babies in tow, sleep deprived, wanting to talk about separating vaccines and doing the best things that they want to do for their kids, they may start mistrusting their doctor because their doctor is telling them that what the president said isn't true. Um, they might be waiting for the MMR to be available separately. That's probably not going to happen anytime soon. So kids are at real risk of missing these vaccines and then becoming potentially detrimentally ill.
Right, and I know we've said it a couple times already, but, my understanding is you don't just suddenly come out with these individual vaccines, like, that would be a long process, and as you noted earlier, there's currently no, incentive to do that, but that also takes me a little bit into the other impact that I thought about right away was what what a what about how this might influence insurance coverage? And if that starts changing it, then maybe that would create incentives and I don't
Yeah.
know, and then suddenly the combined one wouldn't be available, and I don't know
Yeah,
What
so
or vaccines in general become harder to get?
that's a real concern, and that's where the ACIP comes into play again. So that advisory committee is the one who votes on vaccine recommendations after following a rigorous research protocol. And the reason the American Academy of Pediatrics sued Kennedy, and he's saying now the ACIP can't meet because of this lawsuit, which may or may not be true. That ACIP vote influences what the CDC director sets as recommendations. So there's a few steps here when it comes to vaccine recommendations and insurance coverage. The ACIP, who are supposed to be expert scientists, review the data on vaccines. Then they vote on recommendations for vaccine schedules. They send those recommendations to the CDC director. The CDC director either accepts or refuses or modifies those recommendations, and those ultimately become the CDC recommendations. Under the Affordable Care Act, any vaccines recommended by the CDC must be covered by insurance. I don't know what that means if the vaccines are not recommended, that they won't be covered by insurance, because this is an area that's outside of my knowledge of, would insurance companies base their decisions on the data that demonstrates there is a beneficial outcomes, cost outcomes, to childhood vaccinations, or are they going to cut costs in the short term and say, well, if ACIP and the CDC does not deem these necessary, we're not going to cover them? That's still to be determined.
And just to reiterate, that ACIP is the one that's sort of been compromised?
Yes, it has not, it has been compromised. Yeah. So RFK Jr. removed, I think, all 17 members of the Advisory Committee on Immunization. Um, uh, I always forget what the P is escaping me. ACIP, what the P stands for, but he removed all 17 members of the ACIP and replaced them with some scientists, but many vaccine skeptics and anti-vax advocates. And so they have not met for a very long time, since I think January of this year, because RFK says, because of the lawsuit that the American Academy of Pediatrics has brought on them. The American Academy of Pediatrics brought this lawsuit saying that you are not following the rigorous standards that are established for this group. And so instead of replacing them, these members, RFK dug his heels in and said, well, then I guess we can't meet at all. And that means the COVID vaccine hasn't been updated. The flu vaccine has kept going because it took it was not impacted. But until they meet again, these seasonal vaccines cannot be updated. And so that influences a whole other sector of the population.
Yeah. Something else I've seen talked about is just the overall standard of care potential impact there. As we start to have this conflict existing, where there's differences between these different groups, that could impact, you know, clinical policy and, consent, and maybe even at the margins malpractice and things like that. So I don't know if you've had any thoughts on that.
Are you asking how clinicians are, uh, the
Well, how
standards they
these
have to
this
meet?
yeah, like as this if these as this continued to sort of get this gap between what a lot of these government um, organizations are saying and things like the AAP, um, you start to get this gap. I mean, as you were noting before, creates this confusion, and then you could start to see this being issues for professional standards.
Yeah, absolutely. And we've seen this happen with Trump's administration of, during the early days of the pandemic, the Western states deciding their own standards of care, um, and ACOG, the American College of Obstetrics and Gynecologists, saying that, you guys set your standards, we're setting our own based on the science that we have relied upon in the past. So there is still, however, presumably a bunch of physicians who agree with this executive order and may be offering misguided advice to their patients or unideal advice. In my opinion, and that is supported by a lot of science and research and clinical outcomes.
So I don't know if you've thought about um, this question, but what about are there sort of countermeasures, things like AAP and other professional organizations can do to try to counter some of this?
Yeah, I think they have. I think the American Academy of Pediatrics is very good at setting their own recommendations. ACOG has as well. I don't know about other groups, and I'm certainly, not a pediatrician or a gynecologist to speak on behalf of either of them, but that's what I've noticed. Um, and so it's unfortunate that there is such discrepancy and a disjointed approach to something that should be really straightforward.
Yeah, I know we've brought it up a couple times, but I wanna come back to the splitting of the MMR thing a little bit more again, just to make sure we kind of get that out there that, that's it's easy to put that down on a piece of paper, but if we really get into the practical aspect of that, um, and again, I mean, it worries me so much when he says something like it could be lethal if given together like that. And as you say, so there's no option for people today. There probably won't be an option for quite a while. Um, and it also, I think, just adds to this idea of delaying vaccines. And I know, like, for some vaccine hesitant, I get it. Like they might want to split, maybe some of the pediatric recommendations in a little bit. Maybe they don't want to give their kids 6 shots today, and we'll get 3 now and 3 later, a little bit later. But I mean, delaying in general has risks, especially if you kind of really put it off. Maybe never do it. But I guess I want to talk a little bit about first the MMR side, like just some of the pragmatic part of it. Like, there's no option for people there today. And as you say, there's no real incentives. That work would take at least probably 10 years. It would take quite a while to split those out again. And again, there's no incentive to do it today. There's no health reason to do it today. There's no medical reason to do it today. So let's just kind of get that out there a little bit and make sure we I know we've already said it a few times, but I really want to, because he said it could be lethal. I just want to really make
Yeah,
sure
that
that
it could
people
be lethal, so we should separate them without, there's no the MMR vaccine is not available separately. It theoretically could be combined, given separately, but it is not practically available. There is no scientific need, safety need, medical need for them to be separated. And there is, again, no financial incentive for pharmaceutical companies to work on separating them, to absorb that extra cost, because the American president right now has an HHS secretary who is recommending atypical vaccine schedules. And what in addition, we talked about MMR. We also should they also mentioned hepatitis B, saying that hepatitis B vaccine should be selectively administered. We already did that. In the United States before 1991, patients were screened before being given the hepatitis B vaccine. And they keep, this MAGA crowd keeps pointing to places like Denmark, which is such an outlier that doesn't give hepatitis B universal doses, meaning to everyone and all comers. The reasons for that are important to note. Before 1991, when people were screened and babies were screened before receiving hepatitis B shots, 20,000 children a year fell through the cracks. and developed hepatitis B and consequences of it because they were missed. Our medical infrastructure is not reliable enough to effectively screen all of these patients for hepatitis. And also, some children develop hepatitis B without any known risk factors. So we already did this. We've already tried this. It did not work. And remember, Denmark is small, has a smaller population than the city of New York by 1.5 million. It has socialized healthcare. It has readily available access to hospitals. Probably not perfect, but their risk benefit calculation is very different than the United States. And so when you're in a place like this where it is difficult to get healthcare, and then you're relying on that healthcare system to work magically suddenly and pick the absolutely correct people who need every vaccine, we already have proof it didn't work.
That's great. I did not know that. Um, in terms of the splitting these vaccines too, they would have these individual vaccines would have, they talk about being, safer. Well, those individual vaccines would have to go through all the trials and such to be certified as safe. I mean, that process alone could be expensive.
Yeah, I don't know all of the details about that. If we've already, could rely on data we already have about them before they were combined. I'm not familiar enough about the history of MMR and V together.
Yeah.
But there are, even before that step, there's still the overhaul of the manufacturing companies saying like, okay, we'll buy in and do this. What are they getting in return for it?
Right. Well, especially if they're looking at that time window of
2
this
years of
eight
just waiting it
two.
out.
Yeah. I guess that's what we're all doing to some degree. Um, well, and I guess, I mean, so for someone that is a parent that's, heard all this, they're nervous about it, they've, you know, they're every parent is concerned about their child's health, and they're getting information from so many sources. So for a parent that is maybe vaccine hesitant or nervous or feels like they don't know for sure who to listen to, I mean, do you have any guidance for them?
I'd like to say that along with, that same study that noted that upwards of 40% of people listen to what the president says for medical advice, 83% trusted their medical provider. And I think that's far and wide the person to trust and ask questions, especially if it's a pediatrician. We know that not all um, patients have physicians as their primary care provider. But if your primary care provider is a pediatrician, it's probably going to be pretty reliable information. Go to your doctor first. It is very scary to have a child and get these injections that you don't know very much about. But the reasons we have these vaccines is because the data demonstrates that clinical outcomes are better. The health of your child is likely to improve, and it is likely that they will not get very significant infections that are covered by these vaccines. And remember, like varicella, which is chickenpox, most kids do pretty well with a chickenpox infection, right? But coming back to our society, the way we're organized, parents lose time from work taking care of a kid with a preventable illness that's very contagious. Kids lose time in school because they have a very contagious infection. And exposure to varicella is the same. Varicella is the same virus that comes up again as shingles later in life. So if you can, this idea that most kids do fine with chickenpox, most kids do fine with measles, which I've heard from RFK Jr. Most kids don't die. There are other consequences that are preventable from safe vaccines.
Hmm. Yeah. Well, I really appreciate your time. Is there any sort of other final words on this topic?
We could I guess we could talk about the miscarriage. The miscarriage information that's been coming out. I don't know if you've heard about that.
Have
Um,
not heard a lot about this. No.
so, with these if this is related to the
Oh, wait, this is
Fauci
the one where they
hearing.
kinda got the wrong denominator when they
That's
put out
right.
this number? Yeah,
Yeah,
okay.
yeah. So, as part of the Fauci hearing, Rand Paul and Wisconsin Senator Ron Johnson, um, brought information that they said drags Fauci through the mud and claims that Fauci knew that there was an 82% miscarriage rate from COVID vaccines when women who were in their first or second trimester received them. And this is based on a 2021 data set that lasted 3 months based on the COVID vaccine registry early in 2021. It followed about 4,000 women who were pregnant and some of whom were vaccinated to see their outcomes. And it found that there wasn't a change in miscarriage rate as compared for all comers. Um, a Florida OB-GYN decided to manipulate that data and change the denominator and remove 700 women from that study. With his new numbers, he claims that 82% of women who got a COVID vaccine early in pregnancy miscarried. The problem with that denominator is that when the registry stopped, most of those women who received a vaccine early in pregnancy were still pregnant. So they weren't counted. And what's his name? Ted Cruz was talking about this on his podcast and like banging on the desk about it. They know it's not true. Common sense tells us COVID vaccine does not have an 82% miscarriage rate. There is an OB-GYN who's active here on Substack, Jen Gunter, who I think noted that if this was really the case, like women would know, and these vaccine
I think we
clinics
would've
would
noticed that.
probably be banned, become after they would, the anti abortion crowd would come after it. So, all of this is a type of revisionism that is happening about COVID. It's a political circus on the part, it's like people who are opportunists like Rand Paul and who is a physician. Bill Cassidy, who is a physician, played a big role in this also. Um, and then there's fanatics and zealots, which I feel very confident in saying RFK falls into. This is not how we do science. This is not in the best interest of American public. And that's my
Yeah.
soapbox.
All right. Yeah, no, that when I saw that, what they had done to that study, that was wild. Like you say, I think we would have noticed if
Yeah.
80% of people that got the vaccine, yeah, that was crazy. Well, again, Dr. Zeest, thank you so much. I really appreciate I know it was kinda short notice, and I really appreciate you making time for us.
Happy to join.
And I guess, we've got some folks on. I didn't see any comments, any questions in the comments, but if anybody has any, you can drop a question in the comments. Otherwise, we'll give that maybe a minute or two, and then we'll let you go. But I haven't seen any comments, any questions raised yet. So that's because you're so clear in your explanations. There's no questions to be asked. I mean, in some sense, there's not that much to this EO in
Yeah.
some ways, but it's the consequences. That doesn't mean the consequences aren't going to be real.
We should be able to believe our president and these very high ranking leaders. We should be able to believe the Secretary of the Department of Health and Human Services when he's talking about public health. And right now, we can't, unfortunately.
Yeah. Yeah, it's right, it's a whole new world we're in now. Yeah. So, Yeah, one person talks about they're scared because I'm living with long COVID, which I sympathize with that, and I'm sure you especially do.
Yep, absolutely do. Vaccines are really important. We have, the COVID vaccine is not updated. So Diane's asking, does Dr. Khan know when the 26, 27 COVID vaccines will be available? I do not, and nobody else does. And I just did this research recently because I got a mRNA booster because we don't have an updated vaccine for 26, 27. But COVID rates are increasing. And here, especially in California, and here where I am, especially in Central California, and I and multiple of my family members have had bad outcomes from COVID infections. And so we want to protect ourselves. So, right now, because the ACIP has not met and does not have a meeting date set, we don't know when an updated COVID vaccine is coming out. We also don't have an update on either the mRNA or the alternative protein based vaccine by Novavax has not been on shelves since much earlier this year. And even when it was available, it wasn't updated for 26, 27. So, Diane, we don't know when vaccines are going to be available because of all of this mess.
So is it right now the case for even those at risk that would normally be interested in getting COVID boosters, they're just not available?
COVID boosters are available for the current strain. And so when vaccines are made, the ACIP gets together and determines not only like recommendations for childhood vaccines, but also where are we going to target the flu and now COVID vaccine? Which strains are we going to target? Recently, you may have heard that there is an mRNA flu vaccine now available. And that's important because mRNA vaccines can be modified much more quickly than the ones that we typically use. And that means we can wait until closer to flu season and do better detective work to identify which strain is most likely going to be circulating. Right now, the flu vaccine is not that effective because we have to guess, or these experts have to guess so far in advance. And it's hard to do that. So, but nothing is available yet for the new season.
So on the COVID boosters, so if you're in that risk factor group and and there isn't a new one, but the old one is available, would you still recommend people do that?
I went ahead and my family got the current booster in order to do our best to protect ourselves. It's what we have right now. Everyone has to make that decision because the problem with the mRNA vaccines is not like conspiratorial, but very practical. It has pretty severe, strong side effects. Like we were out for a good day and a half. I had to time it on a Friday, find a Friday, everybody was free because I knew our weekend was going to be gone. And if you already have long COVID, sometimes you just don't have buffer room to have shakes, muscle aches, chills, and feel even more miserable. The Novavax vaccine has much fewer side effects and is more tolerable. And it sounds like it's just as effective based on the data I'm familiar with.
And so is the current booster schedule about once a year for people in those risk groups?
I don't know for each risk group, but it's either once a year or twice. But we have seen over the last few years that unlike the flu, COVID spikes in the summer. We're seeing these summer spikes, and it takes a week or two for the vaccine to help build your immunity. So, people who, the data we have demonstrates that people who are vaccinated who develop COVID are less likely to develop long COVID. So we decided on getting boosted so that I have school age kids. They're gonna get COVID. I have to assume.
Hmm. Yeah. Yeah. All right. Well, I really appreciate it again. I thank and thanks everybody for participating, and thanks for your questions in the comments. So well, one person says they had Novavax. So that is available?
It's questionable. Maybe somebody in the chat could clarify. I'm seeing online that it's available, but I also know it was not renewed from what I understand, and the expired bottles were not replaced. I think it was in March.
Mm.
Um, it is not available anywhere close to me. I called all over. And so even the Novavax website that has a pharmacy finder, the places listed on that when I called did not have it. So if people have access to it, it might be a good alternative if you don't want to have the muscle aches and flu like symptoms that the mRNA often gives.
Mhm. All right. Well, I know we've used a lot of your time, so I really appreciate it. But yeah, I really appreciate you joining us. And thanks everybody for joining in and for all your great questions. So I'll let you go. And again, thank you so much.
Thanks, everybody. Thanks, David.